Hi, this is Dr. Moore, and today we're going to talk about orthotics. Now, traditionally, there's only two categories, temporary versus a more permanent custom molded orthotic. They're made, the temporary ones that is, they're made out of different materials, usually mold to the foot over time. They have a limited time span, but do a great job. But most of the patients want the end game, which is a custom molded permanent orthotic. And I like to use the plaster molding technique. There is a laser, there's also a foam impression type of mold. I think they do a great job, but I like the way that this gives the patient an exact mold held in a position. We send ours to a lab that makes a polypropylene, which is a thermal molded plastic product that flexes, so it's more of a dynamic device, holds the arch up, but it still can flex. The two models are one of the thinner models for my athletes. Also my female patients, we can make these for a smaller shoe and a heel. And this is the more stable product that we'll show you up close in a minute to stabilize the shoe inside of a boot or a different type of sporting event. Here's a close-up of the devices. They're made of polypropylene. This is a thermal molded plastic that is flexible. As you can see, if you put a little weight on it, it'll flex. And we can do a shell with a non-skid, and with the half device, it will stay in the shoe. It'll go into the shoe and actually stay in the shoe. And then if you need a little bit of heel control for people who have flattening or pronated feet, we can put a post in. And this post basically stops the patient from pronating. If this is the arch and a left foot, stops the patient from pronating inwards this way. So a heel post, and they're really good for snow skis, inline skates, things where the patient has to have their foot flat, sport-wise, and not move around in the shoe or boot. They don't do poorly in other shoes, but for certain type of tight cleats, things of that nature, it's a little bit bulky, and we go to the tapered model.